Welcome to this explainer. You know, think about a high-performance vehicle. You wouldn't just drive it for decades and completely ignore the maintenance, right? No way. You've got to understand the engine, keep an eye out for wear and tear, and actually stick to a routine schedule. Well, the male body is exactly the same. Today, we're popping the hood and looking at one absolutely vital part of that engine, your prostate. We're going to build a complete blueprint to protect it. But before we dive into the manual, let me give you a quick riddle. What weighs exactly 1 ounce, is shaped kind of like a small walnut, and controls a surprisingly massive amount of your daily health and quality of life? Well, if you guessed the prostate, you hit the nail on the head. It is small but mighty for sure. So let's dive into exactly how it works. Here's a quick roadmap for today's explainer. First, the engine room, anatomy and function. Next, wear and tear, common prostate problems. Then, the maintenance plan, your prostate health playbook. And finally, the diagnostic dashboard, screenings and medical care. Right, let's kick things off with Section 1, the engine room, anatomy and function. So, what exactly is it? The prostate is a small, firm, partly muscular gland. It sits just below the urinary bladder and right in front of the rectum. And here's the key part. It actually surrounds a portion of the urethra. That's the tube that carries urine and semen out of your body. Now, behind the scenes, this little gland is a total workhorse for the reproductive system. It creates these extra fluids that make up your semen, packing in enzymes, zinc and citric acid to really nourish and protect sperm. Plus, it has muscles that actually contract to help push that semen into and through the urethra. Structurally, it's made up of 5 distinct lobes, and they're wrapped super tightly in a stretchy connective tissue. Honestly, it's pretty fascinating. This tissue acts almost exactly like a hot dog casing, just holding the whole shebang firmly in place. Now, one of the most unique things about the prostate is that it doesn't just stay the same size. A healthy, young prostate weighs about 30 grams, which is, about as heavy as 5 US quarters, and it's roughly the size of a walnut. But it naturally gets larger as you age. It can actually grow all the way up to the size of a lemon, and while that is completely normal, think about it. A lemon takes up a lot more room in that tightly packed engine room. Which brings us right to Section 2, wear and tear, common prostate problems. Okay, when we look at the data, it really helps to separate fact from fiction by breaking down the 3 most common conditions. First up is BPH, or benign prostatic hyperplasia. Now, this is a non-cancerous enlargement that usually starts happening after age 40. In fact, almost all males develop at least some enlargement as they get older. Next, right in the middle, we have prostatitis. This is swelling and inflammation of the tissues in and around the gland. Fun fact? Actually, maybe not so fun, but true. This is the absolute most common urinary system issue in males younger than 50. And finally, on the right, prostate cancer. This one is serious. It's the second most common type of cancer affecting males. And the tricky part, you might not have any symptoms early on. That is exactly why understanding the difference between just a simple normal enlargement and actual cancer is absolutely crucial. So remember how we said the prostate surrounds the urethra? Well, as it grows from that tiny walnut into the size of a lemon, it literally squishes the urethra and causes it to narrow. Think of BPH exactly like a kink in a garden hose. The fluid is trying its best to flow outward, but the physical pressure from that surrounding enlarged organ is just totally blocking it. And because of that kink in the hose, the wear and tear eventually shows up. We're talking about things like blood in your pee or semen, having trouble just starting to go, those undeniable sudden urges, or, waking up multiple times in the middle of the night. If you're experiencing pain or severe trouble, do not ignore it. Seriously, that is your engine's check engine light flashing bright red, telling you it's time for some maintenance. Okay, let's switch gears to the solutions. Section 3, the maintenance plan, your prostate health playbook. The great news, you absolutely do not have to just sit around and wait for problems to pop up. The data highlights 3 incredibly effective daily actions you can take right now. Step 1, get moving. Regular physical activity actively lowers your risk of developing that garden hose kinking BPH. Step 2, diet. Loading up on your daily recommended fruits, veggies, and healthy proteins directly promotes a really healthy prostate environment. And step 3, quitting tobacco. Kicking that habit significantly lowers your overall risk for prostate cancer. I can't stress this enough. Diet, exercise, and ditching tobacco are your absolute ultimate frontline defense. Now you might be wondering, hey, what about that miracle pill I saw advertised on late-night TV? Well, the blunt medical reality is this. Dietary supplements do not have to go through clinical trials. They don't even need FDA approval.
And because there just isn't a lot of solid data backing them up, the truth is, most people are not going to see their prostate health magically improve by taking them. So don't look for a magic pill. Look to your daily habits. Moving on to our final stop, Section 4, the diagnostic dashboard, screenings and medical care. Okay, if you remember one single number from this whole explainer, make it this one, 50. Most males should start getting regular prostate cancer screenings exactly at age 50. Now, if you have a family history, your doctor might actually want to start you a bit earlier, but for the general population, 50 is the absolute magic milestone to begin those routine professional checks.
So how exactly do the pros check under the hood? Let's quickly demystify the diagnostic tools your doctor's going to use. First up is the standard prostate exam. This usually includes a physical digital rectal exam, just to physically feel the gland, combined with a PSA blood test. High levels of that PSA antigen in your blood can actually be an early indicator of cancer. They can also run a quick urinalysis to check for bacterial infections. If they need a better look, they might bring in imaging, like an MRI or an ultrasound. There's also a cystoscopy, where they use a tiny little camera to look right inside the urethra. And if they do find a truly suspicious area, they'll perform a biopsy, just taking a tiny little tissue sample to test in a lab. Look, I know it might sound a bit intimidating, but these are incredibly routine, standard tools. They're designed to catch problems when they are small, manageable, and highly treatable.
So we've covered the anatomy, the risks, the healthy lifestyle habits, and the medical diagnostics. You basically hold the entire maintenance blueprint for your prostate health right now. So, my final question to you is, are you ready to take charge of your health today? Whether that means finally hitting the gym, tossing out the tobacco for good, or just calling to schedule that screening for your 50th birthday, the power is entirely in your hands. Thanks so much for exploring this explainer with me.